maybe afternoon, everyone. Today we are going to be discussing the final ICH-GCP R2 changes impacting sponsors and CROs. My name is Mary Mills, and I will be your trainer for today. We will be stopping throughout the presentation to allow you to ask questions. So first, I think I would just like to introduce a little bit more about myself. I do have 35 years healthcare experience and approximately 30 in clinical research. I primarily, over the 30 years, have done a lot of different things related to clinical operations. I was a study coordinator, and currently I do a lot of training, some auditing, and managing of trials. I have worked with this whole process, quality by design and quality risk-based management in a mega trial and numerous mega trials, but one of them was about 17,000 subjects with 50 countries, and we achieved marketing application approval in the majority of the countries where we submitted. I have a lot of risk-based monitoring experience, and I do a lot of training, so that's really enough about me. And I'm really looking forward to talking to you today and answering your questions that you might have. So our agenda for today is the following. We will review the learning objectives. We will do a targeted review of the revisions taken directly from the guideline. Due to the very prescriptive nature of the changes in the guideline that people refer to as R2, but it is the revision, we're going to spend a decent amount of time with Section 5, and that's where I get a lot of the questions. And we'll do a very high-level review of some changes that you can think about to impact your organization, and then we'll summarize the course. There are a few little knowledge check questions throughout the presentation. So for learning objectives, at the completion of this course, you should be able to identify 3 changes, a minimum of 3 changes, that impact sponsors and CROs and your individual roles. You should be able to explain the impact of the revisions on clinical trial conduct and on your organizational practices, or at least start thinking about your organizational practices. And you should be able to discuss the opportunities for implementing the revised guideline within your organization. So let's first look at the drivers for the addendum. And let me provide some background for what happened during the 3 and 4 years that the updated guidance was being put together. As you all know, this guidance was 20-plus years old, so it was pretty much time for a change. I think all of you can agree that if you've been in industry or academia doing research, that we have come a long way and made a lot of changes in 20 years. So the regulatory agencies were first and foremost concerned about the lack of trust for the ICH-GCP statements that were being included in the new drug applications. And they were concerned about the audits and if they were truly giving a reflection of the quality of the trial, hence this word quality. Y'all think about this word quality. There was also some concern over the lack of transparency. Quality had not been clearly defined for the conduct of the study or the planning of the study and the reporting out of the study. So this was something that really was discussed at length, and all of the regulatory agencies wanted to see transparency, and they wanted to see this defined, a quality by design process, not just throw it up in the air and see how it comes out by chance and reporting out that way.